Fabulous. So, Bridget, if you want to go ahead and share your screen, I'll let you get started.
We're good. You can see my screen? Perfect. Okay, I am Bridget Glasspool. I'm the Director of Housing and Community Services at Kitsap Mental Health Services, and I want to talk about our three housing programs that we have at KMHS. So I first always like to start with telling a little bit about our organization. So our mission is offering hope and opportunity through comprehensive recovery-oriented behavioral health care. We're a private nonprofit. We've been around since 1978. Serve more than 7,000 individuals a year. We have more than 600 employees. We have a comprehensive range of services. So some of our services we have adult outpatient. We have child and family. We have inpatient units such as the adult inpatient, the youth inpatient. We have Keller House, which is a stabilization center. We have crisis triage, which is a facility like if you have a police call and it's not maybe a jail call, it's more of a crisis call, they can come to our triage center. We have Pacific Hope and Recovery that is a 30-day substance use treatment recovery. We also have Pathways, which is substance use outpatient treatment. And we have a new team, which is for co-occurring. So you will have a case manager that can see you for both mental health and substance use. And lots of people don't realize we have actually been doing housing since the 90s. Just a little bit about our clientele. 10% of our clients are experiencing homelessness. So, as probably a lot of your clients as well, we just have a large population that are homeless in our county. All of our clients have a chronic mental health condition. Some of them do also have a substance use diagnosis. And most of our clients are either low income or have no income at all. So we do have three housing programs. So Pendleton Place is our permanent supportive 24/7 apartment complex over off of Kitsap Way in Bremerton. I'll talk a little bit about them, a little bit more about it in a minute. Then we also have our supported housing, and the differences between the two is the supportive housing is scattered site. So we have 8 shared houses where each resident would get their own room but share the rest of the living space. 15 single houses, and then 5 family houses. We have staff that support them Monday through Friday during regular work time hours between 7 a.m. and 7 p.m. And then we also have our HARPS program, which is housing and recovery through peer supports. And that's people with lived experiencing, helping and walk alongside those with mental health or substance use disorders, find housing, and then retain housing in our community. So Pendleton Place is permanent supportive housing. So the definition of permanent supportive housing means that they could live there forever. It's their forever house. We offer supports within the building, as well as everyone pays 30% of their income for rent, and that includes their utilities. Because our services are not mandated, we're always looking for opportunities to offer engagement, connecting people to mental health, connecting people to primary care, connecting people to substance use treatment, as well as just working on their housing treatment plans with our staff. We have staff and security on site 24/7 just to help the residents that live there. As we know, people that are come from chronically homeless are often victims, and we want to protect them and make sure that they are feeling safe. It is housing for single adults. When we designed this model, we wanted to make it as low barrier as possible. So our only showstoppers into getting in is a registered sex offense and or manufacturing methamphetamines in a federal building. So that's why we made it for single adults only because of the being so low barrier. We have lots of partnerships in this project. Bremerton Housing Authority is our landlord, and they also offer subsidies to each of the units. Um, Peninsula Community Health Services has a clinic that is open Tuesdays and Thursdays from 9 to noon in our building. We have partnerships with senior commodities that drop off there. We have partnerships with the VA that come does additional case management. We have partnerships with taking people to food banks. There's a lot of different people in our community that help us with those residents. I think of the real team often comes and gets people connected to substance use. We do a housing treatment plan, which means we meet with each resident and we let them make a person center plan around their housing retention. And those can be something like creating boundaries with other residents. It could be getting out and about in the community. It could be just around food security. So the plans vary resident per resident. I have one resident that's currently writing a book on her story, and I can't wait for that to actually be finished. I'm excited to hear what she writes about. And to get into Pendleton Place, everyone goes through Housing Solutions Center because we don't want to miss any population. Housing Solutions Center is coordinated entry for Kitsap County. So everybody that is homeless goes through that system to get a shelter bed. Their information is tagged and it is sent to both myself and the manager of Pendleton Place every Friday. And we get a pull from that list as we have openings. I'm a big fan of pictures, so I just wanted to show some pictures. We opened on May 17th of 2022, so we've been around for a little over 3 years now. We have 36 studios and 36 one bedrooms. No rhyme or reason to those numbers other than that's how the architect could fit it on the property that we purchased. And then they are fully furnished, so people can come in with just what they have on their back. We have clothes, we have food. It's fully furnished. They have all their needs can be met just walking through the door. I always like to point out that Kitsap Quilters made a quilt for every single bed. So I thought that was kind of an awesome gift at our opening. Our next project is our supported living. So with this project, this is for Kitsap mental health clients only, but we don't want to just miss the clients in our offices. So our team sends out an all staff email letting everybody at our agency know that we have an opening. But we also let Housing Solutions Center know we have openings. So if they notice anyone on their application there marks that they have a mental health diagnosis, they can ask them if they're a client and refer them here to get on our fill out the application to get into our housing when we have openings. Our maintenance team goes out and does a monthly inspection with all units. We want to make sure that they are decent and safe for people to live in. Lots of times with people with mental health issues, maybe they might have schizophrenia and they're hearing voices. They don't always hear the shower dripping or water dripping. And so we want to make sure that we get ahead of those repairs that need to be done. This program also does a housing needs assessment and creates that person center plan with each of our residents. Most clients we go out and meet with weekly. We do referrals to other agencies for what they need. We give them resources for stuff that they could utilize, and then we always collaborate with their care teams to make sure that we're giving them the best care and the best living situation that they need. Again, a few pictures, one of our single units and one of a shared living house. Our HARPS team. So that is our housing and recovery through peer supports. The eligibility of this program. And this program takes internal referrals from Kitsap Mental Health and then external referrals from all other agencies. So you guys can do referrals to this program as well. They could be coming out of an inpatient setting, might it be mental health or SUD. They could be coming from an outpatient setting with a diagnosis, and it doesn't have to be being at an agency like ours. They could be seeing their doctor for depression and just having that diagnosis. They need to be homeless or at risk of losing housing. Their average median income needs to be 50% or below, and then they cannot be connected through foundational community supports. The HARPS program is kind of like the gap filler for people that don't qualify for FCS. Services that we provide. We help people fill out applications. We contact landlords. We take them to look at units. We outreach our clients so we can see them in their home. We can meet them at a library or a Starbucks. We can meet them out in the community. We do housing and employment search. Oftentimes, once they get housed, we help them with the budget. We teach life skills. You'd be amazed at how many times people might not know how to clean a unit or how to ride the bus, and we kind of help them with those things. We provide resources. And then lastly, our program has no funding dollars. So we have to go to KCR, which is Housing Solutions Center, and get in line with everybody else to access funding for our clients. All three of these programs run off the Fidelity model. So, a little bit about the Fidelity model. I always like to go through the dimensions. Our first one is housing choice. We explain to everybody coming into any of these programs about the different types of housing there are in our community, and we let it be their choice if they want to live in our housing, live in a subsidized unit, live in a shared living, maybe live over in Oxford, but we let it be their choice on where they want to live. The separation of housing and services. In all of our housing units, we have a landlord team and then we also have a service team. We want to make sure the client knows who is responsible for them with their lease, with their housing, who has master keys to their unit, and then what team gives them those wraparound supports so that we're not crossing those lines of fidelity. All of the houses that we offer are decent, safe, and affordable. Those that our HARPS team house people in the community, we often go through the decent, safe, and affordable guidelines with clients because at the end of the day, sometimes their choice is to pay a little bit more than they can afford for the unit that they want. And then housing integration. We have housing as south as Port Orchard and as north as Suquamish. We didn't just buy like a block of Burwell and say everyone with a mental health disorder has to live on this block. We want to integrate our population throughout our community. And then rights of tenancies, if you live in Kitsap mental health housing, you are on a lease. We're not a program, so you have rights as a tenant where you live. Access to housing. That means that we take people just the way they are. We don't put requirements. They don't have to be in treatment. They don't have to be on medication. We don't put those requirements to get into our housing or be a part of the HARPS program. And then flexible voluntary services. People can tell us, I don't feel like meeting today, or they can say, can I skip a month? I'm, going through some things. They have the rights to, as often as they want to meet with us, or maybe just take a break from us. Some people want to meet a couple times a week. Some people want to meet once a week. Some people meet with us monthly, but usually people want to engage because they know that we are here to give them supports. And that is the end of my presentation. I know that I talked fast and I go over a lot of things quickly. So I definitely want to open it to any questions and I'll stop sharing so you guys can see me and I can see you for the Q&A.
You all are welcome to either come off mute or shoot your questions in the chat. I do have a couple questions, Bridget, if
Yeah,
anyone
go
has
for it.
any. So the first one that I have is um, I know that you all offer foundational community support through some of your services. How would folks refer people to you to like use that service for
So,
FCS?
so currently we're only doing FCS with people in our housing programs just because we have limited staff. I'm hoping to grow the staff so that we can take outside referrals for that, but right now we just don't have capacity.
Sure. And then you mentioned that you would take referrals and things like that. I'm curious to hear like how often are you having openings and things like that on your different housing spaces?
Okay, so right now we do have a couple openings for Pendleton Place. We have a move-in coming in next week, and then we do have another unit becoming open. So they'll be pulling from the priority pool from Housing Solution to get somebody that moves in. We do not have a whole lot of openings at Pendleton Place. I can sit here and say I have some stats. Wait, I wrote them down for another thing that I am doing. Um, since opening with Pendleton Place, just to give you an idea, we have we still have 45 of the original 72 people at Pendleton Place. We only did 8 evictions in the last 3 years, and those were all behavioral based. We had 11 move outs that people moved in. They moved out with their Section 8 voucher, or they moved into adult family homes because they were getting older, and or a few moved out with relationships or family. We had 3 people relinquish, and unfortunately, we have a third of our population is elderly, so we did have 8 deaths. So we don't have a whole lot of movement in that program. With our other housing program right now, we do have three male openings, and we are currently taking applications from our care coordinators up until the 26th.
Nice. And I think that kind of answers the one of the questions in the chat, which is, are you all currently full at Pendleton Place? So it sounds like you are.
Yeah, yeah. Like I said, we're having that one opening that they are pulling someone from the wait list hopefully this week to get that process started.
Any other questions from the group? Alrighty, I'm not seeing mics coming. Oh, Tammy, do you have a question? I see your mic off. Or maybe my screen is weird. It might be my screen. Okay, so I don't see it. Sorry. I don't see any other questions. So cool. I don't see any other questions. So I think we're good for today, Bridget. I just want to thank you again for taking time out of your day to chat with us. It's always super helpful to know like what programs we have access to and how to support our care coordinator. So just want to thank you again for taking time out of your day.
Thank you for having me. And I just put my email in my chat. So if any of you think of questions later on, you can definitely shoot me an email. Thank you for
Awesome.
having me.
Absolutely. Awesome. Well, thanks y'all. I'm going to stop recording and we'll see you next time.